Okay, so how do we actually do compressions or do CPR on my patient? So there's two components to the CPR part. Okay, one is the compressions and one is the breathing. Okay, and we'll talk about compressions first. So compressions on an adult, we have a rate, and that rate, how many times per minute, that rate is going to be 100 to 120 compressions per minute. The other thing that we want to take into consideration for our adult patient is we want a depth of at least 2 inches, no greater than 2.4. If this was a child patient, that depth is slightly less. And what American Heart tells us is that depth is going to be 2 inches or 1/3 the AP, anterior posterior diameter of their chest. The rate is still 100. If it's a child, it's still 100 to 120 times per minute, but the depth is slightly a little more shallow. Now, when we actually do compressions, there's two parts to that. There's the compression stroke, and then there's the recoil stroke. Both are vitally important. The compression part, when we push down, what we're doing is we're actually compressing the heart muscle, which is a hollow organ, and it's going to eject blood out to the body. We're trying to oxygenate really two primary organs. One is going to be our heart, the other is our brain. When I compress the heart, that blood goes out, and primarily we're oxygenating the brain. Now the recoil, when I come back up, the recoil part of it, that's when my heart fills and the coronary arteries fill. So essentially, we're oxygenating your heart at that time. So two organs. One is when I push down, I oxygenate your brain. When I recoil, we oxygenate your heart. So both of those are vitally important. So how do we do this? We always want our patient on a hard, flat surface, okay, and we want our patient as close to us as possible. What we're going to do is we're going to use the heel of the hand, and the heel of the hand is going to go in the center of the chest on the lower half of the breastbone. Now you have this little notch right here, and this is your xiphoid process. It's kind of hard to see on this mannequin here, but it's right up in here, and it's this little diamond shaped structure. We do not want to be covering that. We want our hands, the lower half of the breastbone, which is kind of just below the nipple line, okay, but not covering that xiphoid process. So again, we want our patients on a hard, flat surface. We want them as close to us as possible, and we're going to take the heel of the hand on the center of the chest, lower half of the breastbone, and we're going to kind of put our hands over each other. Either way doesn't really matter, one on top of the next. Okay, we can interlock our fingers, or we can leave them like this. We're going to get up over our patient. We're going to bring our elbows up underneath our body so that they're straight, and we're going to compress straight up and down. Okay, now that rate, again, for all patients, whether it's an adult, a child, or an infant, that rate is always 100 to 120 beats per minute. The depth of compression on an adult is at least 2 inches, no greater than 2.4, or the depth on a child, which is going to be, that depth is 2 inches, or 1/3 the AP diameter, anterior posterior diameter of their chest. So what it would look like, again, we're going to get up over our patient and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Okay, and we're going to do 30 compressions followed by 2 breaths. 30 compressions to 2 breaths. And that's essentially one person CPR. So we'll go into the breathing next, and then we'll put it all together.